All right, well, people are usually concerned about mercury in their food, but it could already be in your mouth. For more about dental health concerns, I'm joined by Dr. Michelle Jorgensen and Dr. Ashley Hyde from Total Care Dental. A really serious problem that people might not know about these silver fillings. Talk about the dangers.
You know, everybody calls them silver fillings, but I actually nearly lost my career 5 years ago because I was having so many health problems and didn't know what it was from. It was from mercury poisoning.
Not because you had it in your mouth, but because you were...
Yeah, I was drilling out other people's mercury fillings that needed to be replaced, and I was breathing in all those vapors. And I was so ill, and I didn't realize why. And then I thought, if I'm becoming ill from this, what is it doing to my patients? People call them silver, but they're 50% mercury.
That is shocking. And we were just having a discussion thinking, oh, it's actually silver, the metal, but it's only we're talking about the color, but it's really made out of mercury.
Yeah, there's a little silver in there, a little silver, a little copper, a little nickel, little other materials, but 50% of it is actually mercury.
And how did they find out that you had mercury poisoning?
You can get tested for it. So I got tested in high levels of mercury. So it's a big concern. So we want to tell people not only are those concerning, but if you do have to have that filling removed, that's the most concerning time. So, you know, Dr. Hyde knows a lot about how to remove them safely.
Yeah, so at our office we really try to focus on removing those amalgam fillings safely because the most exposure you will get is from the vapors that are released when you're placing amalgam fillings or when you're taking them out. And so when we take them out, we want to do it safely. So we have a strong air filtration system. We put on a rubber dam that's kind of like a raincoat. The patient wears oxygen, and we have masks and other things that we use so that it's safely done and minimizes the risk if our patients need it.
So people shouldn't really have maybe a knee-jerk reaction like, oh, let me go get my fillings taken out right away. We need to find out how this particular, you know, whatever office you decide to go to, how they strategically remove these fillings, correct?
Yeah, there are ways to do it safely, and there are ways, if you just drill it out like you typically do at the dentist, it's not safe. You're going to be exposed to a lot of mercury. And you know, people are very concerned about mercury in vaccines, mercury in fish. It just always makes me kind of confused why this isn't known. That 50%, we're still putting, I'm not, but dentists are still putting these fillings in children. You know, that concerns me. So I really wanted people to know that this is mercury.
That is astonishing that this practice is still going on today. In fact, you guys decided to change your entire way in your career and how you approach dentistry.
Yeah, completely, because I thought if this is hurting me, it's hurting other people. So we look at your whole body. How can everything that's going on up here affect you everywhere? And it's been amazing, the response, because people really want to know that.
Okay, so you have, so say someone has the silver fillings in there now. How much is being released if they don't do anything?
So there's a lot of mercury vapors released when you're just chewing, when you're grinding your teeth, when you're eating. Any heat that you're drinking, coffee or hot chocolate, anything that you drink will help release vapors. But the most that's released is when we're actually taking them out. So that's why it's so important to remove them safely.
And real quick, 10 seconds, what are some of the symptoms and effects that you had and you want to tell other people?
Brain fog, numbness, digestive issues, just feeling lousy, really.
All right. Thank you so much for that information. Glenn, back to you.
All right. Thanks so much. Still ahead in your entertainment news tonight, we're going to take a